Small batteries, big risks. What happens when a child swallows a button battery? Children actually swallow button batteries more often than you might think. When children swallow these batteries, they get stuck in the esophagus. This is really dangerous because the battery still conducts electricity and can severely burn the esophagus in 2 hours. Over time, it can burn into organs and cause life threatening injuries. We spoke with families whose children swallowed button batteries, and they shared their stories with us. First, we asked what were the events leading up to your child swallowing a button battery?
My younger son with autism. He went to sleep, but around 10:30 p.m., he started to cry.
Sick with COVID, and we had taken her to the hospital to get x-rayed to see if she had pneumonia.
So I got a call around 10 p.m. that my eldest son's not feeling well and we need to take him to the hospital. He's been throwing up continuously.
So she was having a really hard time swallowing and said that her throat hurt.
And then I said, "Did you eat something?" And he said, "Yes."
The doctor said, you know what, let's just do an x-ray. Everything looks okay to us, but just for the sake of it, let's just do an x-ray before we send you home.
They noticed that she had a metal coin circle in her x-ray, that it was in fact a button battery that she had ingested.
What do you hope other parents can take away from this?
I learned that a lot of kids ingest button batteries, and a lot of kids ingest a lot of other items as well.
I wish both me and my husband had this knowledge to just ask for an x-ray or an ultrasound.
And I think that's the best we can do, that to spread the awareness, to talk about these things, and that make sure that people know how to react.
You know, these are very dangerous things, and they can definitely hurt children.
We spoke to a leading expert in button battery ingestions, Dr. Nicholas Wolter. First, we asked, why is urgent action so important?
We need to act fast because a serious burn can happen very quickly. The esophagus can be permanently injured in as little as 2 hours, and some burns can be life-threatening.
What makes button batteries so dangerous compared to other objects a child might swallow?
Any object that a child swallows can cause harm, especially if it's sharp. But button batteries are so dangerous because they cause a chemical burn that worsens until the battery is removed in the operating room.
How can parents tell if their child has swallowed a button battery? What if the event was unwitnessed?
Most button battery ingestions are unwitnessed, and it's very hard to know if it's gotten stuck. If you suspect your child has swallowed a button battery, you need to go to the hospital right away and get an x-ray.
What symptoms might a child have after swallowing a button battery?
Some children who have swallowed a button battery will experience things like pain, sore throat, or have increased drooling or decreased oral intake. But the scary thing about button batteries is most children have no symptoms at all, and that's why prevention is so important. But if you suspect your child has swallowed a battery, get them to a hospital right away.
What specific steps should a parent take if their child has swallowed a button battery?
The most important thing to do is to go to the hospital right away. Do not try and make your child vomit. On the way to the hospital, if your child is over 12 months old and it's been less than 12 hours since the ingestion, you can give your child honey, which coats the battery and may reduce the burn, but do not give them anything else to eat. When you get to the hospital, make sure to tell the doctors and nurses that you think your child has swallowed a battery. They may give your child a medicine called sucralfate while the child is waiting to go to the operating room.
So how do we prevent children from swallowing button batteries in the first place? Well, beating button batteries is as easy as breathing AIR, air. First, we want to avoid purchasing high-risk items. We can buy batteries that are stored in child-safe blister packaging. We can also buy batteries that have a bitter-tasting coating so that kids are less likely to swallow them. Using rechargeable devices can help avoid batteries altogether. Next, we want to identify items in our homes that can contain button batteries. Common items containing button batteries include remote controls, toys or games, LED candle lights, car keys, and thermometers. Finally, we want to remove button batteries safely. Dead button batteries are still alive and can conduct electricity. That's why we want to cover them with tape, but more importantly, dispose of them right away in drop-off depots and recycling centers, which can be found online. Thank you so much for watching. You can learn more at beatingbuttonbatteries.com.